Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center and by viewers like you. Thank you.
How's that temperature?
Good.
That good? Okay. No, it's kind of a different Thanksgiving for me, so.
Yeah.
January 12th, I'll start my chemo and Herceptin treatments.
Okay.
Everybody's just kind of trying to take care of me, and
Are you feeling okay?
yeah, I feel great. I mean, it's like what I tell everybody is I feel absolutely fantastic. I just can't imagine that I'm fixing to have to go through what I'm about to face. My name is Merry Lunsford. I'm 45 years old, and I was recently diagnosed with invasive ductal carcinoma. I'm a single mother of 4 daughters, and so I'm very busy. Yeah. All right. I do feel great. I feel fantastic. I can't believe that I have breast cancer. Well, you know, I mean, just yesterday, you know, because when I'm talking to my clients, other people overhear us in our conversations. Yeah. And, you know, everybody has somebody that is close to them that's experienced it. And I'm definitely not a unique case, I know that. But the crazy thing is people are getting it in their, earlier and earlier.
Like 66, 67.
Yeah. But just make sure you keep those tatas checked. Now, do I look like a hairdresser?
You look like you're a consummate professional.
I think I'm ready. I think I'm ready.
I think you are ready to impress the public. So I guess I should go over and you can work.
Okay,
And,
give me a hug.
It's so good to see you. I love you.
How are you doing today?
This was my birthday cake.
Oh, when was your birthday?
It was Sunday.
Oh,
That my daughter baked for me, and I
Okay.
got you a piece to
I love carrot cake. You want to put a smock on?
I do.
I'll get your color mixed. But once I got busy, I started feeling better. So there it is. All right, I'll see you in a minute. Sometimes I kind of look at myself as being somewhat of a chemist because we do have to measure and formulate and come up with that perfect formula for each client. As far as what my career does for me is I immerse myself into them because I want to help them. And then I kind of see myself as a caretaker, you know, or maybe a psychologist. I definitely am an artist. Tell me about what role you had when you worked in Memphis and their breast care center.
People came in and got their mammograms
Okay,
done.
all right.
Their screenings, and then if there was some problem or symptom, we did diagnostic.
Okay, yeah. Unfortunately, my mother was diagnosed with breast cancer at age 36. She died when she was 42. And I'm 45, just finding out that I have breast cancer, but I plan on surviving.
I know that most women say, if I don't have family history of breast cancer, guess what? I don't need a mammogram. But that's not true. Majority, or 3/4 of breast cancer is detected in women with no family history of breast cancer. The family history of breast cancer puts a woman at higher risk of developing breast cancer, but no family history does not mean that you'll never develop breast cancer.
My name is Katrina Myricks, and I'm a 3-year breast cancer survivor. There is no family history for me dealing with breast cancer. When I was 48 years old, I went in for a routine mammogram, and they found that I had a lump in my breast. So I did not find it, they found it, and at that time they told me I was diagnosed with triple-negative breast cancer.
Even though the breast cancer incidence is lower in African American women, the breast cancer mortality is higher, primarily because of the predominance of a more aggressive form of breast cancer in African American women.
Triple-negative breast cancer is a rare cancer. It's an aggressive cancer. I was diagnosed in January. I had just buried a friend in November, and another friend, I think it was around April. So that was 2 friends. But in the back of my mind was, it comes in threes. And the next thing that I was thinking was that I was the 3rd one. And I was not ready to leave my daughter.
Tonight, a government advisory panel weighed in with updated recommendations that could make that decision even more difficult.
The ever-shifting guidelines for starting mammograms leave some women feeling like they're playing a game of chance.
USPSTF, or the task force, as they call it for short, they laid out the guideline that a woman should start her annual mammograms at the age of 50 and then have it done every other year instead of every year. Now, the second body that issued guidelines was the American Cancer Society, and they said that women between ages of 40 to 44 do not need to get a mammogram every year, or mammogram at all. Starting at age 45, they can consult with a doctor whether to get it done every year, but they do recommend every year.
Welcome back to Southern Remedy, your weekly Dr. Call-In show. Those of you who've been listening to the news are probably totally confused about breast cancer and breast cancer screening from all of the information that you're hearing. There are several different groups of doctors who are experts that get together and make recommendations for what kind of screening should be done in breast cancer prevention, right?
That's right.
And they have different opinions. Is that where the confusion is? What's the deal?
Yes. So several years ago, the U.S. Preventative Services Task Force came out, and they recommended that we delay screening mammography till age 50. Just recently, the American Cancer Society has come out and said maybe we should start at age 45 instead of 40. Discuss it with women at average risk from age 40 to 44, but they said you can start at age 45.
Kind of the number that's out there right now is that 1 in 8 women are going to be diagnosed with breast cancer. And so if more people have access to health care who currently don't, I mean, that just increases your numbers of people who are going to be diagnosed.
What are the risk factors for breast cancer?
Increasing age, like you mentioned, anything that increases your exposure to estrogens, like Dr. McKinney said, a family history, not only of breast cancer, but ovarian cancer, prostate cancer, other cancers can run in the family and put you at increased risk.
Let's go to Ellis and Tunica. Hey, Ellis.
Good morning.
Thanks for your call. What's going on?
I have 5 daughters, so I'm surrounded by breasts.
Mm-hmm.
I had bladder cancer a year ago, and I'm clear now. But does that give us any reason for additional caution?
There's no breast cancer, there's no prostate cancer, no ovarian or other female GYN cancers, and they don't have a known genetic mutation or anything like that, or they don't have any other medical problems that are associated with breast cancer. They are considered to be at average risk. And that means by current guidelines, we would discuss mammography with them starting at age 40, but if they're average risk, according to the American Cancer Society, they would start at age 45.
Who says you can get it at 40?
Well, that's what Dr. McKinney was saying. You really have to document. You really have to look at each individual patient, look at their risk factors, look at their family history.
But that some other group says you ought to get it at 40, right?
Well, American Cancer Society was the main one that was holding out. No, that's still controversial.
The governing body for radiology and breast imaging is the American College of Radiology, and that's the guidelines that I trust the most because they have the most and current data to support their guidelines. And that data suggests that a woman starting at the age of 40, an asymptomatic woman starting her mammograms at the age of 40 and going annually has the maximum benefit.
Doesn't it make more sense to get it early and frequently rather than intermittently?
Well,
what is the risk?
In my opinion, I would say yes, because I see a lot of breast cancer. But the reason they're saying to hold off is to decrease the chance of getting false positives. In these younger women with more dense breasts, there is an increased risk that someone might see something that they think is abnormal, that this patient might get a biopsy, which is benign, that maybe was unnecessary.
We have a breast cancer problem, and we'll talk about it if you give us a call at 1-877-MPB-RING, 1-877-672-7464, right after this quickie break. I want to talk about health disparities. I want to talk about black women and breast, and I also want to tell you I'm very pissed off that they're saying that me as a primary care doctor should not be doing breast examinations when I do a history and physical. That is awful, and the residents are hearing it, and when I say in morning report, what was the breast exam, they said we don't do those.
Well,
how can you
they
tell
also
us
need to be doing self-breast exams.
Well, that too.
Yeah, absolutely. They're telling us not to do that.
A good majority of our patients in their 30s who are diagnosed find something
they
themselves.
find it.
I still think you should have a clinical breast exam yearly by either your primary care doctor or your OBGYN. I also think women should continue to do monthly self-breast exams, because it is not uncommon for me to see a patient, or for lots of people to see a patient who recently had a normal mammogram and then they pop up with a lump 2 months later.
All right, so you good to play with us? You're gonna have fun. I had gone out to play some tennis, and I came home and I was pretty sweaty, and I had a kind of burning, itching sensation just underneath my right armpit. I reached up to kind of scratch and just make that little burning sensation go away, and I noticed there was a small knot. I thought, this doesn't feel quite right. And so I ignored it.
No, I say up or down. You say up or down, see Kyle. Up or down.
And then maybe a couple of weeks later, I still had another episode where it began to kind of have an itching, burning sensation again. And once again, I reached up to feel that the knot was still there. I didn't try to move it around or anything. I just thought I needed to go ahead and have a wellness exam done. The mammogram really didn't show just a perfect view. So from there, I went in to have a sonogram done.
Her twin sister, Sherry, just so happens to be a sonographer.
She happened to be the sonographer scheduled for the sonogram that day.
Sherry scanned it, and she was like, "Oh, Mary, you need to have this taken out." And she's very persistent, Sherry is.
From there, the doctor comes in, and he said that, normally they would just suggest that they would see me back in 6 months, and that he felt certain that it was nothing to be too alarmed about, and that if I wanted to come back in 6 months and have them scan it again, they would.
Working on that.
And from there, they walked out of the room, and then within just a minute or two, they walked back into the room, and the doctor decides to refer me to a surgeon.
Oh, good shot, Ryan.
Things would be different for my mom if my aunt would not have been so persistent in urging the doctors to go ahead and take it out. Because if she would have waited, it could have gone into stage 2 or 3 without us knowing.
Oh, we got lucky.
Had I not had her there, and had I listened to the doctor about waiting 6 months, my prognosis would be in a totally different situation.
Good match. Enjoyed it.
Annual screening mammograms, the purpose is to detect the cancer at its smallest, earliest stage. That doesn't mean that mammography will find 100% of breast cancers. We find majority of the breast cancers.
A lot of times you'll find that people are reluctant. Number one, they don't know what to expect. And the only thing they hear that their breast is going to be squeezed in a machine, so they don't know what to expect.
We always compress the breast for a mammogram, and the compression is done mainly to separate the breast tissue out so you can actually see underlying masses or abnormalities, if there are any, better.
My breast cancer was found through mammogram, and the option that was presented to me by my surgeon was lumpectomy. Once hearing about the lumpectomy and what the procedure was going to be, my next question was, what about a mastectomy? And when we talked about the mastectomy, I was informed that there was enough margin going around the cancer that they were able to cut it out.
You're listening to Southern Remedy on 1-877-672-7464 is our number. We still have a little bit of time to take your calls. Dr. Kraft, my wife, when she started having mammograms, would pick the person to do it because every time this guy did it, he squeezed her so hard she got bruises. Should we avoid men doing mammograms?
No, but I do think, as with all tests, and as with everything you get done, whether it's your haircut, whether it's your mammogram, there are certain people who tend to make things a little more comfortable, a little more pleasant experience.
Do mammograms hurt now?
They are
some women
still
have tender
a little
breasts, right?
uncomfortable. I think it depends on the person. I think they still can be uncomfortable. They do compress the breast, which is different than compressing your hand.
You need to have your screenings. I think you don't need to ignore anything that's concerning, whether it's because of fear, access to care. If you find something abnormal, if you're worried, you need to get it checked out.
Hey, baby. Did you have a great day? Yeah. I'll have surgery on December 3rd. And for my oldest daughter, it's going to be kind of difficult because she's going to have to make major changes, where the 3 younger ones will stay with their normal activities. We're not going to disrupt their activities at all. And for me to be able to do that for them, Brooke has decided that she would like to make a job transfer.
And I decided to put in for a transfer to move back up here to help more take care of the girls, get the girls to school, get them back from school, and do all their extra activities so she wouldn't have to worry about that.
She's going to take my role of being that chauffeur or taxi driver. So everybody's going to keep on with their normal schedules. Actually, Reagan and Avery Wednesday night are going to spend the night with Vicki because I have to be at the hospital probably pretty early Thursday morning. Bye, SM. I love you. I made the decision at the very end to do a bilateral mastectomy. I forgot my blanket, the one that's crocheted.
Crochet.
Yes. I come from a long line of breast cancer. Thank you. I didn't want the breast cancer to even repeat itself again. I don't like having to stop in my steps and take care of myself now, and I definitely don't want to have to return and do it for a second time. So for me, it just seemed to be a wise decision to go ahead and take care of it all. And after the bilateral mastectomy, I'll have reconstruction done immediately the same day. It definitely will not be completed that day, but we definitely will begin the very first baby steps of my reconstruction. And for me, the reconstruction was vital because my memories of my mother was just seeing a chest, a concave chest, because she had had such a radical mastectomy. They removed everything, and nothing was replaced. Can I go ahead and start walking in? Yeah. Okay. For me, being a 45-year-old single mother, that's not what I really wanted my girls to have memories of like I have. And thankfully, nowadays, they can do reconstruction, start the reconstruction the very same day. The day that I got home, I felt okay. I was still experiencing a lot of feeling tired. I was still feeling very sick from the anesthesia and some of the pain medicine that they were giving me. Hey, George, I'm so glad you came to see me.
I don't know your neck.
Well, today, my oldest sister, she has come to visit. She's here to get me on a new diet. I just didn't have any clue as to what was about to happen and how I was going to physically manage it. And as of right now, I've overcome it, and I'm feeling pretty good about it. I do have some moments where I do hit a little tired, stage, and I just have to take a moment and rest. What she talked about was my diet and how I needed to even increase my amount of protein. And I didn't know this, but protein has a lot to do with healing.
Yeah, and that's why I brought you the chia seeds.
Oh, okay, those are
like
protein.
Yes.
I'm 8 weeks out into my recovery. I've started back to work this week. Seems like everything's going really good, and my clients are just excited to have me back. There are small procedures that you have to go through before we actually do the reconstructive surgery. The reconstructive surgery won't happen until after I'm finished with all my treatments. I do have a best line, and that is the shell of my breast, and inside the shell of the breast is something called plastic expanders. They slowly inject a saline solution to increase the size to create a pocket, and in that pocket that they're trying to create, they will later be able to put an implant in that pocket. Yeah, I was telling somebody the other day that it's kind of funny how we have this love affair with our hair, When I saw it falling out last week, I just had a complete meltdown. And of course, it's the inevitable. I mean, it's something that's going to happen, and you already know it's going to happen. But still, when your time comes to start losing it, it's really kind of difficult.
Chemotherapy, is a drip drug, but they also give you several other drugs before you really get to the chemotherapy portion. Mine was what they call the red devil. And so when they tell you that you have the red devil, I had one of the harshest ones, and that's because of having triple negative.
I've already been through one chemo treatment. It was only minor discomfort. It wasn't anything that knocked me off my feet. I was still able to get up, move around. I did small housework like folding clothes, wash dishes. But in the midst of all of that, I did experience severe nausea, vomiting, and I did end up having a severe headache that wouldn't go away.
Chemotherapy is different for each individual because it's going to work on your body. So it's going to entail what shape you're in, what other things are going on with your body. And that honestly, you can't really listen to other people because what I went through, you may not go through.
When I noticed that my hair began to fall out on day 15, I decided I wanted to do something fun because having 4 daughters, it can be kind of traumatic for them to see and experience my hair loss along with me. So my co-workers joined in with us. They all came in on a Sunday evening to give each one of my girls a hot pink streak in their hair, and then of course we decided to do my whole head pink and crossed our fingers that it wouldn't fall off my head. So and luckily I had pink hair for about 2 days, and it gradually has gotten thinner and thinner and thinner. So today we're going to just go ahead and zip it off. I had a pinch of pain.
And it's still pretty and pink.
Great as a fuchsia.
Mary, you have the perfect head, baby. I'm trying to be tender. I know, Mary, you've got the perfect head. Really, you do. It's like,
I love that it's pink. What a beautiful. You look so beautiful. Oh my God. I love that you're in all pink today too. You look like a rock star.
I think I've just embraced a new look. I love it. I think my eyes are popping.
They are.
They look bigger, and I feel beautiful.
That smile.
I do. I feel beautiful. Thanks, ma'am.
Oh my God. Oh my gosh. Woo.
So, yeah, I feel beautiful. This is a good cry.
When I was diagnosed with breast cancer, I lost my hair in 2 days from chemotherapy. 2 to 3 days, I was bald. And I came here for a wig.
You guys are the greatest. We brought more wigs.
It was sort of funny for me coming here to get one, but I just didn't expect to find what I did, which was not a good selection. Another one of my sorority sisters came. She had a bout with cancer, was not breast cancer. And she called me. She said, Katrina, I don't wear wigs, but that place over there called American Cancer Society, they don't have any cute wigs. We got to do something about that. For 3 years, we would support the Diva Den with wigs. So last year, we collected over 50 wigs. So we brought wigs and wig brushes. Being a person who lost their hair, when you're going through cancer, and you do have all your treatments you have to go through, you still want to look beautiful. And you're going to have your days where you're very weak and you don't feel like putting on your makeup or doing these things. And when you're bald and you walk out in public, sometimes people look at you and it doesn't, you are feeling very insecure. But when you have that hair on your head, believe it or not, you can hide a lot of things. I have a passion for these ladies now as they lose their hair, that you still want to be beautiful. And some have a hard time losing their hair, very hard time.
I think our Delta years did pretty good with the grades.
Being diagnosed with breast cancer can be a bad thing. But going through the process of never being detected can be even worse. And what I mean by that is if you don't do self-breast exams, if you don't go in for routine mammograms, you never know, what's wrong on the inside if you're not taking care of yourself.
I personally still think you should start at age 40. At a minimum, start at 45, but I would still say 40, and I think a lot of other leaders in the field would still start at age 40.
Right now, there are so many guidelines out there. I would be thoroughly confused if I wasn't a medical professional.
You need to have your screening. If you find a lump, you need to see your doctor. You need to see someone and have that evaluated. You don't need to ignore it.
Educate yourself, empower yourself, read the statistics, read why it was okay to get a mammogram every year starting at 40 up to last year, and now it's not okay. Go to the website endtheconfusion.org and read the benefits of getting an annual screening mammogram starting at age 40. In my opinion, that is the best guideline for any woman who is at age 40 or over to come in and get her screening mammogram every year. Mammography saves lives.